See that this slide is a pretty busy slide. You'll be relieved to know I'm not going to go through it in detail, but I just wanted to talk a little bit about resilience and actually how utilising other organisations to provide resilience for your staff might be an option that you want to consider. So SCW, we're an NHS provider, and we provide consultancy and other services to a whole range of NHS organisations. And building resilience within the workforce requires many approaches and different lenses, and you'll understand that from your perspective. And that can cover from well-being to being more proactive around workforce planning. Throughout the ongoing pandemic response, we're seeing systems take a much broader view of how and who work can be delivered by, which leads to a more resilient and innovatively delivered workforce and product. Examples of some of these new approaches that you may well be using and may be aware of include using volunteers and cadets, the development of new roles such as additional roles, reimbursement scheme, which is in primary care, the ARRS, snappily titled, and using retired resources more flexibly as well to encourage people back into the workplace who maybe don't want to work in quite the same way as they did when they left. And using a wealth of data-driven insights, organisations and systems are much more able to plan and pinpoint the pinch points for win workforces that we are starting to see now, and the future issues that we can probably predict that are coming down the chain. And that enables new options for novel and wide-ranging solutions that we can explore more creatively to respond. And there's a couple of examples on this slide, but one in particular that happened as a result of the pandemic when we went into lockdown back in March 2019 was the or 2020 it was, wasn't it? The clinical assessment service, the COVID clinical assessment service that we set up. We did that in partnership with SCAS, the South Central Ambulance Services, and we recruited and appointed over 2,000 GPs who came from either practice where they'd been locums and weren't being utilised, or retired GPs who wanted to return back into the scheme to do their bit for the NHS. And we used digitally led innovation to allow them to work remotely and safely. They supported over 500,000 patients via NHS 111, and we introduced live real-time reporting and dashboarding, candidate management systems and workflows to be able to support NHS 111 at the time. And as a result, we were able to flex and plan their workforce around this additional surge capacity, which meant that it was better supported for the patient care going through that period. And the partnership model saw us building and managing a workforce that looked at the referrals in real time and conducted clinical assessments on their behalf. And it meant that SCAS met the requirements of their pandemic response much better and could deal with the surge requirements, which was already very pressured, as you can imagine, in the delivery teams within that organisation themselves. And we, as an organisation, want to continue on building on that innovation. So CCAS was one example, which was then demobilised a few months ago. But we are retaining that GP workforce by launching a new scheme, by retaining them, and again offering them out as a clinical workforce solution to support the already engaged and employed workforce, again for additional surge and capacity, so that we can help support your organisation's employees become more resilient, because we can give you some additional workforce really as and when required. Other examples would be that we provide flexible resource at short notice, which we manage, so it's outsourcing in effect, but again, not on a permanent basis. It can be on a very short-term basis to give you more workforce for things like volume recruitment. So we engage with a number of providers during the vaccination recruitment process, which obviously was high-scale recruitment, to do some of the more back office arrangements and back office work, to release your staff to do the stuff that they really needed to do and they really needed to focus on, while we did some of the more administrative stuff such as DBS checks, just engaging and recruiting, contract production, those sorts of things. And again, it's a skill that we can put into the system, and we can turn it on and turn it off to give you greater capacity, which again lends your organisation more resilience by supporting the staffs. So organisations, I guess, and I know you will be challenged in this, but we'll be working towards it, need to be open to new and novel ideas, and often great suggestions come from within their own teams. And it's an ongoing process that needs leaders to be open to experiment and to look at new ideas. And some arrangements may not work at first and will need to be adjusted, and that's all okay. It's normal and an important part of the process. But one of the biggest drivers of the workforce resilience is leaders themselves. And their ability to understand and address the barriers that preventing employees from having a healthy work-life balance and experience many things that have been covered on this panel today by all of the speakers. And the pandemic has led many employees to rethink about the importance of work in their lives and to change their relationship towards it. And we need to grasp that and recognise that as well. And leaders need to regard this as an opportunity for organisational transformation that benefits both their employees, their organisations, and the patients and the populations that they serve. And we very much enjoy working with a whole variety of NHS providers and NHS organisations to support them with that. And I think I'm just going to hand over now to Kevin to take questions from the panel.